nurse today. Can you confirm who you are? Tell me your name. Mallory Higgins, and you are how old? 15. Okay. We're going to do an assessment on you from head to toe. We're also going to assess your cranial nerves. Do you need to go to the bathroom or anything like that before we get started? All right. First, we're going to assess her appearance. She is a, how old did you say you were? 15-year-old female. Her body structure is within normal limits for her height and weight. She is mobile. She was able to ambulate into the facility with no problems or assistance needed. She is awake and alert. Can you tell me what day of the week it is?
Friday.
And what month?
December.
Can you tell me who the president is?
Obama.
All right, thank you. Mallory is alert and oriented. She does not have any problems telling you what day and time it is. What would you do, for instance, if you saw a house on fire?
Call 911.
Call 911, thank you. All right. Next, we're going to measure her vital signs. First, we will take her temperature. We're using a tympanic thermometer. 97.7. We will take her blood pressure next. Blood pressure is 116/62, so it is within normal limits. Her pulse is 72. It can be counted for 15 seconds and multiplied by 4. And while assessing her respirations, you can pretend that you are still checking for a pulse, but at the same time you're counting respirations so that her breathing is not abnormal. At this time, she is breathing at a regular rate and rhythm with no abnormalities noted. Next, we're going to take a look at the head assessment. Mallory's face is symmetrical. If you will sit up for me. We will palpate the head to determine if there are any abnormalities noted. There are no lesions or bumps or abnormalities that I can see. Next, we're going to take a look at the external eye. We're going to inspect the eyelids, which her eyelids are normal. Thank you for closing your eyes. We're going to look at the sclera is normal, conjunctiva is normal in color with no abnormalities noted. We will next test her vision, her near vision. Now I'm going to have you hold this about 14 inches from your face. I want you to start reading at the top line and read as far down as you can go.
9, 5, 8, 7, 4, 2, 8, 4, 3, 6, 3, 8, 8, 7, 4, 5, 6, 3, 9, 2, 5, 4, 2, 8, 3, 9, 5, 3, 7, 4, 2, 5, 6, 9, 3, 7, 8, 2, 6, 4, 2, 6, 8, 3, 9.
Okay. And you have 20/20 vision. After checking her near vision, we will check her pupil size and shape. And her pupils are approximately 5 millimeters. They do react to light. and they do accommodate. When checking the pupil size, we're going to use the ophthalmoscope to take a look at Valerie's eyes. We're going to look for a red reflex and look right eye to right eye and left eye to left eye. And the red reflex is positive, no abnormalities noted. Next, we're going to take a look at Mallory's sinuses. I'm going to touch your sinus cavities just to see if there's any pain or tenderness. If anything feels funny, just let me know. Any pain when I do this? All right, here. Okay. We will then take a look at the inside of her nares, check for symmetry. They are symmetrical. Do you feel any congestion or stuffing or anything like that? No. Next, I will have you take one side of your nose, use your finger like this to close it. I'm going to have you close your eyes. And I want you to sniff. See what you smell. Thank you. All right, let's try the other side and see if you can smell something. Thank you. Sorry, it is a little strong. Next, we're going to take a look at the inside of the nares, just to determine if there's any irritation, any redness, anything abnormal. And everything looks good there. Do you have any pain or discomfort in your nose? No. All right. Next, we're going to take a look at the external ear. We will palpate the pinna of the ear. Is that curved or anything like that? The mastoid. Does that hurt at all? And the trachea. Hurt at all? Okay. Next, we're going to take a look at the ear. And for an adult, Mallory is of adult size, so we're going to use adult regulations on her. Pull the ear up and back. There is no redness in the ear. Everything looks normal there. The tympanic membrane looks a nice pearly color. There's no redness, irritation on the inside. Next, I'm going to stand behind you and I'm going to whisper something. I want you to tell me whether you can hear me or not. Okay? First, I'm going to cover this ear. What did I say?
Oh, silence. Okay, wait,
Thank you. Moving on. Next, we're going to take a look at the inside of her mouth using the light. You can open your mouth. The inside of the mouth appears normal with no redness or lesion. You look for me. You feel it looks normal, no swelling of the tonsils. Everything looks within normal limits. Next, we're going to take a look at her vasculature of her neck. I'm going to palpate for a carotid pulse. It's nice and strong. Nice and strong. And next we will listen for carotid bruits using the bell of the stethoscope. Next, we're going to check for any tenderness in the lymph nodes. We will start with the preauricular lymph nodes in front of the ears. Any tenderness there?
No.
Okay. And behind the ears, the postauricular lymph nodes. The occipital. The tonsillar lymph nodes. then we will check the supraclavicular. Any pain or discomfort in the room? Next, we're going to check your thyroid. What we're going to do is, Mallory, I'm going to stand behind you and I'm going to have you swallow a little bit of this drink while I palpate the thyroid at the same time. First, let me check it. All right. Okay. No abnormalities are noted there. Next, we're going to assess for any vascular abnormalities in her upper extremities. Skin appears normal, no redness, no swelling. Check her pulse. Radial pulse is normal. Ulnar pulse is normal. And we'll check the other side. Both pulses are strong bilaterally. Next, we will check for capillary refill. Good quick capillary refill and no clubbing noted in the fingernails. Next, we're going to palpate